everyone. Happy evening, a very good evening. I hope and I believe the audio visual is all good and all of you are doing well. A quick note whether the audio visual is all good. All right. So happy evening, everyone. I hope and I believe all of you are doing well. And welcome to today's YouTube live class where we are going to discuss biochemistry, like short 150 series. Let me tell you, this series is useful for FMG students and also for NEET PG students or AIIMS students as well. So it is not that it's only for FMG students, but this is going to be a rapid revision like before the exam, the most important and the frequently asked topics. Rahul, how many short have I taken? So we have done anatomy and pharmacology also in the last 2 days on Unacademy app. Those are free classes. If you missed the live classes, then you can definitely watch the recorded classes as well. You would get the links on the Telegram group. So our today's focus is on biochemistry. Tomorrow, same time, that is at 5:30 p.m., we will be doing the last minute rapid revision of radiology, revising the important images that are most important. Yes, Zeth, today we have this one class. And tomorrow also we would be having radiology last minute revision, like the most important topics, images in radiology that you should revise one day before the exam. We'll also do a quick review of what has been asked in NEET PG 22 so that you get an idea what can be expected, right? So, Rich, vitamins. Zaid, absolutely. There is a detailed session on vitamins that I have taken in NF100. Please watch that session. All the important topics about vitamins has been covered there. Today, I'll be just skimming through the most important topics in biochemistry that has been asked in the recent years as well, included in the FMG exam. Okay? All right. So let's start with the discussion. What happened with the video? I think it's all good. Okay. So let's start with the discussion. Tomorrow we would be doing radiology. ECG also I have taken recently. You can get the link on Telegram group. Before the NEET PG exam, I had taken last minute revision of ECG. So please watch that as well. A PDF if you want, my friend, I'll be sharing it on the Telegram group. Okay. So what condition is this? Classical, very frequently asked, there's hyperuricemia, there is intellectual disability, and there is history of self-mutilation. Okay, very important. Yes, this is the diagnosis of Lesch-Nyhan syndrome. Okay, this is the diagnosis of Lesch-Nyhan syndrome. Classically, there would be history of hyperuricemia and self-mutilation like nail biting, or the person is banging the head on the table. And what enzyme is deficient? Right, it's your HGPRT deficiency. What is the inheritance pattern? Very important. Remember, it is X-linked recessive. Whenever it's an X-linked recessive disorder like hemophilia A, what is given in the clinical scenario is that the maternal uncle of the patient had the disease. It generally affects the males more than females. Okay, remember, this is X-linked recessive. This is not autosomal recessive. Very important. Okay. So this is Lesch-Nyhan, which is HGPRT, complete deficiency basically. Next one, what is the diagnosis here? There is burnt sugar odor urine and the plasma levels of leucine are raised. What do you think is the diagnosis in this case? We are revising the recently asked questions and topics in biochemistry. Burnt sugar odor urine, and it is plasma leucine levels are increased. Absolutely right, Zaid. That is maple syrup urine disease. Right, burnt sugar, or they can also give burnt the caramel odor or burnt sugar odor or maple syrup. So remember, this is maple syrup urine disease. What is the enzyme which is deficient here? What is the enzyme which is deficient? It is branch chain amino acids basically, which are the metabolism is defective. It is branch chain keto acid dehydrogenase which is deficient, right? So there is a maple syrup. Maple, you can remember this as like there is a maple tree which has multiple branches. So remember it is branched amino acids. Defect, which are the branched amino acids? Can someone tell me which are the branched amino acids? Remember, when we are live, liv is the mnemonic for that. When we are live, when we are living, we branch out, right, into multiple generations. So remember, live, that is L for leucine, I for isoleucine, and V for valine. Remember, it's leucine, isoleucine, and valine. It is not lysine here. Lysine is not a branch chain amino acid. Okay. Now, even in these branch chain amino acids, can you tell me? So, amino acids excreted in maple syrup urine disease would be leucine, isoleucine, and valine, which are basically branch chain amino acids. Out of this, tell me which is glucogenic, which is purely ketogenic, which is both glucogenic and ketogenic. Which is glucogenic, which is ketogenic, which is both gluco and ketogenic. Yes, Abhishek, this will be available till the exam and after that as well. Remember that ketogenic, which are the pure ketogenic amino acids overall as well, which are the pure ketogenic amino acids. The pure ketogenic, remember alphabetically K ke baad it is L. So it is leucine and lysine. Okay, Zaid, it's not isoleucine. It is leucine and lysine. Okay, there's some confusion. Remember, it's leucine and lysine which are purely ketogenic. Isoleucine, remember iso matlab like isotope, isoform. It exists in two forms, that is both glucogenic and ketogenic. Valine is only glucogenic. Okay, remember valine is only glucogenic. Okay, so leucine and lysine are pure ketogenic. Your aromatic amino acids plus isoleucine are both glucogenic and ketogenic. Yes, Zubair. TIP is basically the mnemonic. Okay, TIP is your mnemonic for both glucogenic and ketogenic. You have a tryptophan, tyrosine, isoleucine, and phenylalanine. Okay, lysine is purely ketogenic. So, maple syrup urine disease branch chain, if you are asked what vitamin supplementation can you can give in this patient to improve the symptoms, basically for treatment, remember it is thiamine. Okay, it is thiamine, vitamin B1. This enzyme branch chain ketoacid dehydrogenase, similar to pyruvate dehydrogenase, similar to your alpha ketoglutarate dehydrogenase. What are the cofactors, coenzymes which are required? Remember, the mnemonic is tender loving care for Nikita or Nikita's family. TLCFN. That is thiamine, lipoic acid. What coenzyme A? Then there is FAD and NAD. So thiamine, that is vitamin B1. Then you have lipoic acid, coenzyme A. FAD, that is vitamin B2, and NAD, that is vitamin B3. These are required for these three enzymes. Okay, remember these three enzymes, the coenzymes are the same. Okay, these five are required. All right, let's go to the next one. Vitamin ATP7A deficient is in which condition? If there is ATP7A defect or deficiency, what is the disorder? What is the diagnosis? ATP7A, is it Wilson's or it is something else? Very good, Zaid. It is Menkes-Kenkes disease, right? This is Menkes disease. Remember ATP7B, B is for beta. Okay, B is for beta. Beta matlab sun. So that is Wilson's. Okay, that is Wilson's. So remember ATP7B is Wilson's, ATP7A is Menkes. Both of these are problem in basically copper. Both of these are related to copper. What is the enzyme deficient in Menkes disease? That is what is asked next. What is the enzyme deficient in Menkes disease? It is lysyl oxidase, right? It is lysyl oxidase which is required for collagen cross-linking. Okay, which is required for collagen cross-linking. Wilson's may, what is the chromosome number? Chromosome number 13, the inheritance pattern, it is autosomal recessive. And right, what happens to ceruloplasmin levels and urinary copper? Remember in Wilson's, ceruloplasmin levels are decreased, urinary copper is increased because it is free copper, urinary copper, it is increased. Okay, urinary copper is increased, ceruloplasmin is decreased. What is the gold standard investigation for Wilson's? It is liver biopsy, basically to look for copper deposition. And what are the clinical features in Wilson's? Wilson's is basically liver is affected and brain is affected. Basal ganglia mein there is deposition, so abnormal movements, psychiatric manifestations. So liver and brain manifestations. In the eye there is KF ring. All these are important. Okay. So remember, ATP7A is Menkes, which is copper deficiency. ATP7B is Wilson's, which is copper excess. And this is what is the very, very frequently asked image in the exam. This is where you would see the KF ring. Okay, the copper ring decimates membrane, that is Wilson's, showing the KF ring. Okay, showing the KF ring. What kind of cataract do we see in Wilson's? What kind of cataract do we see in Wilson's? What cataract is seen? Is it snowflake cataract? Is it rosette cataract? Absolutely right. Remember Wilson. Okay, remember Wilson. It is your sunflower. Okay, it is sunflower cataract which is seen. Okay, it is sunflower cataract which is seen in Wilson's. Okay, okay. Going to the next one. What do you think is the vitamin deficiency here? When a patient has macrocytic anemia, there is increased homocysteine levels, but methyl malonic acid levels are normal. What is the vitamin deficient here? Is it folic acid deficiency or is it B12 deficiency? Why do you say it is folic? Why not B12C? Most important, when you have macrocytic anemia, now either we think of folic acid deficiency or vitamin B12 deficiency. Now when there is increased homocysteine levels, tell me what vitamin deficiencies can give homocysteine. If you have to mark one, homocysteine urea is due to deficiency of, remember homocysteine is like homocysteine. So it is vitamin B6 deficiency. But remember, it's not just vitamin B6, even your B9 and B12 deficiency can cause increased homocysteine. So basically multiples of 3. When methyl malonic acid is normal, so increased homocysteine is 6, 9, 12. Methyl malonic acid is normal, so that is why it's not B12. Because if it was B12, methylcobalamin, remember methyl malonic acid will be high. So this is not B12, this is folic acid deficiency. Very, very important when a patient has folic acid deficiency and when a patient has vitamin B12 deficiency, what is the history that is given? Folic acid deficiency, the history would be the patient is having a lot of junk food and basically no leafy vegetables in the diet. Vitamin B12 deficiency, the history would be it's a pure vegan diet that the patient is on, right? So these would be the history. Folic acid is B9, vitamin B12, basically it's your B12. And remember that for folic acid deficiency, F for F, we do the Figlu excretion test, or EFGH. H is alphabetically, that is histidine load test. Okay, we do histidine load test. For vitamin B12, the most important is increase in methyl malonic acid levels. This is very, very important. And B12 deficiency will cause neuropathy. It also causes your subacute combined degeneration of the cord. Okay, it causes subacute combined degeneration of the cord, where classically the symptoms would be, remember it affects the SCD, subacute combined degeneration affects SCD, that is spinocerebellar tract, corticospinal tracts and the dorsal column. When the dorsal column is gone, in that case, the patient has loss of vibration and loss of proprioception. Okay, loss of vibration and loss of proprioception is what we see. Very, very important. Now, since we are at spinal cord, also remember important point about Brown-Sequard syndrome. Okay, this is very, very important and frequently asked. In Brown-Sequard syndrome, what side, what symptoms are gone? Opposite side, what symptoms are gone? So just remember this, that opposite side, OPT, opposite side, it is pain and temperature. Rest everything goes on the same side, be it the motor symptoms, be it vibration, proprioception. Only opposite side is pain and temperature. Pain and temperature is basically your spinothalamic tract. Spinothalamic tract. Where does the crossing of the spinothalamic tract occur? At the spinal cord level itself, right? The crossing is at the spinal cord. The rest cross in the medulla. So remember, it is just opposite pain and temperature. Okay, opposite pain and temperature. That is, Brown-Séquard cord is basically your hemisection of the cord. Okay, it is the hemisection of the cord. Very, very important. All right. So this is basically homocysteinuria. You can see that methionine forms homocysteine and then it forms your cysteine. The classical one, the enzyme deficient, is cystathionine beta synthase, which is pyridoxine dependent. Homocysteine gets converted to methionine and that requires folate and B12, right? That's why in homocysteinuria, you can give the treatment of betaine. It's the alternative pathway to metabolize homocysteine to methionine. So betaine can be given. Okay, betaine can be given in the treatment. And homocysteinuria, remember the classical clinical features are, it is similar to Marfan's. It's a tall patient. Okay, it's a tall patient with long limbs. There is less subluxation which is there. And it's a prothrombotic, pro-atherosclerotic state. Right, so there will be MI in a young patient, like a 30-year-old patient with MI stroke. This toxicity which is shown. Am I audible and visible now? A quick nod from everyone. Audio visual good? I'm not sure on this. I think yes. Okay, let's continue. So remember that fluorosis causes osteosclerosis. Okay, fluorosis causes osteosclerosis. And you would also see the interosseous membrane ossification. Okay, the interosseous membrane ossification is what we would be seeing. Okay. Let's go to next one. Tell me, glutathione peroxidase, what metal is required? What metallic cofactor is there in glutathione peroxidase? Very, very important. Glutathione peroxidase. What metal is it? Is it copper? Is it zinc? Is it selenium? Is it chromium? What is required for glutathione peroxidase? What is the cofactor for glutathione peroxidase? Right. So very, very important. Remember, it is selenium. Okay. So for all your thiowala enzymes, thiowala, remember, it is selenium. For thiowala enzymes, it is selenium. Okay, it's selenium. Let's quickly revise the cofactors, the most important ones. Remember for zinc. Okay. For zinc, remember zin is an alcohol. So remember, it is alcohol dehydrogenase for zinc. Alcohol dehydrogenase, remember gin is an alcohol. Zinc के साथ rhyming is carbonic. So it is carbonic anhydrase. Okay, it is carbonic anhydrase for zinc. And then molybdenum. Someone said molybdenum. Remember molybdenum, MO is XO, that means it is xanthine oxidase, which is molybdenum. Okay, xanthine oxidase is molybdenum. For copper, remember, like copper is coppery. All your Y containing enzymes like tyrosinase. Tyrosinase, Y in its spelling, it is copper wala. Lysyl oxidase, the one which we saw in Menkes disease, that is your copper wala. So remember, Y wala is your copper. So these are at least the bare minimum that we should know. Selenium is thio wala. So remember, selenium is glutathione peroxidase, thioredoxin reductase, and it is deiodinase. So basically, io ya thio wala, that is selenium. Okay, that is selenium. Zinc, that is gin. Carbonic anhydrase, alcohol dehydrogenase, alkaline phosphatase, this is zinc. Copper tyrosinase, the enzyme which is deficient in albinism, it is copper. MO is XO, xanthine oxidase. Iron, remember, succinate dehydrogenase. Okay, so remember MSD, like MS Dhoni. Okay, remember, like MS Dhoni is an Iron Man. So basically SD, that is your succinate dehydrogenase, it is iron wala. Okay, it is iron. And what is M for? Remember, malonate inhibits succinate dehydrogenase. Okay, malonate inhibits succinate dehydrogenase, very, very important. Succinate dehydrogenase is what complex of the ETC? It is what complex? Remember, it is complex 2. Succinate dehydrogenase is your complex 2. Basically, which starts with FAD. Okay, this is FAD dependent. All right, let's go to next one. If there is delayed wound healing, what vitamin deficiency it is, right? It is vitamin C deficiency. Okay, vitamin C deficiency. Why vitamin C deficiency? Because remember, C for C, vitamin C is required for collagen, and collagen is important for wound healing. That is why vitamin C deficiency, it is delayed wound healing, it is basically scurvy, vitamin C deficiency. The classical history would be history of gum bleeds, and very, very important, there would be perifollicular hemorrhages as well. There would be subperiosteal hemorrhages, pseudoparalysis, all those would be seen with scurvy. Okay, all those would be seen with scurvy. Vitamin C is responsible for, very good, Dr. Benedict, it is hydroxylation, right? Remember, C has a lot of water, that is hydroxy. It is hydroxylation of which amino acids? Of proline and lysine in collagen. Okay? Next one, and also remember that vitamin C is very important for iron absorption. It increases the iron absorption. That is why when someone takes iron, we say give vitamin C wala, like amla, orange juice, vagera, because it will increase the iron absorption. Very, very important. Next one, fat is stored in the tissues in what form? Fat is stored in tissues in what form? So basically, adipose वगैरह में जो fat होता है, it is stored in what form? Remember, it is in the form of triglycerides. Okay, it is in the form of triglycerides. So adipose वगैरह. What enzyme helps in the deposition of triglycerides? Enzyme which increases the storage in the adipose of these triglycerides. Is it hormone sensitive lipase or is it lipoprotein lipase? Remember, it is lipoprotein lipase, that is LPL. It is the one which increases the stores. The one which causes the breakdown of the stores, that is hormone sensitive lipase. Out of these, insulin stimulates which hormone? Insulin stimulates lipoprotein lipase because insulin is basically anabolic. It increases the stores, right? And your adipose wala, basically it's your what? GLUT receptor, GLUT transporter in adipose. It is GLUT4. GLUT4 is basically insulin dependent. It is present in adipose. It is present in heart, muscle and skeletal muscle, right? It is present in heart and skeletal muscle. Okay. Next one, a very, very frequently asked question, xeroderma pigmentosa. What defect is it in xeroderma pigmentosa? Is it base excision repair? Is it nucleotide excision repair? Is it mismatch repair? What defect is there in xeroderma pigmentosa? There would be history of skin lesions. There would be history of skin cancer, photosensitivity. All of those would be there. What is the defect in xeroderma? Remember, X is basically excision defect. Okay, in xeroderma pigmentosa, it is excision defect. What excision? It is nucleotide excision, right? It's not base excision. It is nucleotide excision defect. Okay? So remember, it is nucleotide excision repair defect. In HNPCC, another important question, remember, that is your mismatch repair defect. Mismatch repair is your hereditary non-polyposis colon cancer. So there is increased risk of colorectal cancer, Lynch syndrome, basically endometrial cancer वगैरह होगा. ठीक है? Even your Lee-Fromeny syndrome, which is DNA damage response, which is defective. Remember, in Lee-Fromeny, it is P53 mutation, okay, which is the policeman in the cell cycle. P53 mutation will lead to a lot of cancers. Next one. What is the enzyme deficient in von Gerkes? What is the enzyme deficient in von Gerkes? अंकित ऐसे तुक्के नहीं मार सकते, तुक्के थोड़े से लॉजिकल तो होने चाहिए. Von Gerkes, von is 1. Okay, remember, it is glycogen storage disorder type 1. The enzyme deficient is glucose 6 phosphatase. Okay, the enzyme deficient is glucose 6 phosphatase. Where is this glucose 6 phosphatase present? Liver, or it is, remember, this is not glucose 6 phosphate dehydrogenase nahi hai. It is glucose 6 phosphate, which is phosphatase, which is deficient, which is present only in liver. It is not present in the muscles. This is the enzyme which is required for both gluconeogenesis and glycogenolysis both. That's the reason that in von Gerkes, both the processes are defective. So there is severe hypoglycemia. Okay, there is severe hypoglycemia. Along with that, classically, there would be history of increased uric acid, increased lipid levels. There is ketone bodies which are increased, lactic acid which is increased. All these are there in von Gerkes. Okay, all these are there in von Gerkes. Okay. Next one. So remember some important points about your glycogen storage disorders. Very, very important. Von Gerkes, glucose 6 phosphatase, hepatomegaly, renomegaly is there. There is doll-like facies. There is severe fasting hypoglycemia, lactic acidosis, hyperuricemia, hyperlipidemia. Your type 2 is Pompey's. Pompey's affects the pump in the heart, that is in the body, that is the heart. There is cardiomegaly and heart failure. Pompey's is your lysosomal enzyme. It's a lysosomal storage disorder. It is acid maltase which is deficient. Then you have 3 glycogen storage type 3, that is Cories. Remember, C is the third alphabet. It is A, B, C, D. In Anderson's, it is branching enzyme which is defective. In Cories, it is debranching enzyme which is defective. Anderson, remember, when you write A, it is like 4. Anderson is glycogen storage disorder type 4. It is branching defective. Cories is debranching defective. Okay. McArdle's M for M, it is muscle glycogen phosphorylase. When muscles are affected, there would be exercise-induced cramps. There would be second wind phenomenon. The muscle breakdown will lead to myoglobinuria. Okay. Then you have HERS, HE, which is liver, which is hepatic glycogen phosphorylase. And then you have TARUIs, which is RBCs, which are affected. So there would be hemolytic anemia. The enzyme is phosphofructokinase. Okay, phosphofructokinase. Okay. All right. Now coming to the next one, which is basically your mucopolysaccharidosis, Hurlers and Hunters, which are the most important. What is the enzyme deficient? So remember, the mnemonic is hide. Okay, the mnemonic is hide. What is hide? That in Hurlers and Hunters, basically the enzyme is iduronic wala. Either it is iduronidase or iduronate sulfatase. What accumulates is dermatan sulfate and H for H, heparin sulfate. So what accumulates in Hurlers and Hunters? Remember, it is heparin sulfate and dermatan sulfate. The enzyme deficient is Hunter's TE is your iduronate sulfatase. Okay, that is iduronate sulfatase. Hurlers is alpha L iduronidase. Hunters require a good vision. So remember, there is no cornea clouding in hunters. And remember, hunter hunts with an axe. So that is X-linked recessive. Okay, hunters is X-linked recessive. Rest of them are autosomal recessive. Remember that hunters is X-linked recessive, but Huntington's is autosomal dominant. Okay, Huntington's chorea is autosomal dominant. Hunters is X-linked recessive. Which lysosomal storage disorder is X-linked recessive? Which lysosomal storage disorder is X-linked recessive? Yes. Remember, it is Fabry's. Okay, it is Fabry's. So write Fabry's as Fabrics. Okay, that tells you that it is X-linked recessive. Okay, it is X-linked recessive. Fabry's is X-linked recessive. In which lysosomal storage disorder do we have crumpled or wrinkled tissue paper appearance? Remember, crumpled paper you give to someone, tissue paper, when someone is crying with a lot of pain, that is ouch, ouch. That is Goucher's. Okay, Goucher's has a lot of pain. Basically, there would be bone pain because the bone marrow is affected. That leads to pancytopenia, anemia वगैरह होगा, bone infarct होगा. That is Goucher's. Where do you get zebra bodies? Which lysosomal storage disorder there is zebra bodies? Remember, zebra bodies is Niemann-Pick's. Okay, it is Niemann-Pick's where you get zebra bodies. What is the enzyme deficient in Niemann-Pick's? Remember, it is sphingomyelinase. Okay, it is sphingomyelinase which is defective. Sphingomyelinase, remember NIP. When I write sphingomyelinase, ulta NIP, that is Niemann-Pick's. So imagine that Niemann is a man who's crossing the zebra crossing and he's picking his nose, Niemann picking his nose, and there is foam coming out. So remember, there are foam cells also in Niemann-Pick's. Okay, there are foam cells also. Recent NEET PG 22 question, there was a history of cherry red spot. What is the diagnosis if there is cherry red spot? Remember, lysosomal storage disorder where there is cherry red spot, if it is hepatosplenomegaly which is present, that means big organs. Big is pick, that is Niemann-Pick's. If it is tiny organs, that means no hepatosplenomegaly. So remember, tiny is Tay-Sachs. Okay, tiny is Tay-Sachs. So Tay-Sachs and Niemann-Pick's both have cherry red spot. Here there is hepatosplenomegaly, here there is no hepatosplenomegaly. Apart from that, Tay-Sachs. Remember, Tay-Sachs X wala enzyme, it is hexosaminidase A which is deficient. This is what was asked. Okay, this is what was asked in NEET PG 22. It is hexosaminidase A. Remember, there is onion peel like appearance of the lysosomes. Okay, onion peel appearance of the lysosomes which is seen with Tay-Sachs. Alright, so these are the important enzymes that each one of you should know, very, very important. Let us quickly revise. So remember, Goucher's has U in its spelling. The enzyme deficient is glucocerebrosidase, U wala, not galactocerebrosidase. Tay-Sachs is hexosaminidase A. It is all AA. Fabry and Crabs. Fabry is alpha galactosidase and Crabs is beta galactosidase. That is galactocerebrosidase. Fabry is only one B. It is not, so it's not beta, it is alpha. Crabs is beta galactosidase or galactocerebrosidase. Niemann-Pick is NIP, sphingomyelinase. Okay, sphingomyelinase. So rest we have already seen. All these enzymes are very, very important. You get questions on this very, very frequently. Now, if you get a question on amino acid disorders, right? Quickly, let us revise what are the important points in amino acid disorders. Very, very important. Give me a minute. Okay. So in amino acid disorders, what are the quick points? You get short questions on this in your exam. Okay, what are the questions? First, phenylketonuria. What are the key points about phenylketonuria? What is the enzyme deficient? It is phenylalanine hydroxylase. Okay, the enzyme deficient is phenylalanine hydroxylase. What does this enzyme do? It converts phenylalanine to tyrosine. So this step is defective. That is why tyrosine cannot be formed in the body. So tyrosine becomes an essential amino acid in phenylketonuria. Classically, what are the clinical features that we have? What odor do we have to the urine? Remember, it is mousy or musty odor. Next, it causes mental retardation, development is affected, there is blonde hair because basically tyrosine is not there, so melanin will not be formed, blonde hair, fair person, all those will also be the features. Okay, that is phenylketonuria. So, that is phenylketonuria. The next amino acid disorder, very, very important, it is alkaptonuria. What will you see in alkaptonuria? Alkaptonuria basically is a problem with tyrosine metabolism. And what is the enzyme deficient? Homogentisate oxidase. What is the classical keyword? It is black colored urine on standing. There is black urine on standing and it can lead to arthropathy, right? The joints can be affected. Plus there is ochronosis, that is basically black pigment of the cartilage. Ochronosis, pinna, nose ka cartilage will become black. So remember ochronosis and you have arthropathy. All this is very, very important for alkaptonuria. Next one that we have, which is frequently asked, is albinism. What are the important points about albinism? What is the enzyme deficient? It is tyrosinase. What is the inheritance pattern? Very important. It is autosomal recessive. What is the chromosome number? Right, the chromosome number is 15. What all do we have on chromosome number 15? I hope all of you remember the family of chromosome number 15. There is father, there is mother in the family, there is tall son, and there is fair daughter. Father, paternal, is your Prader-Willi syndrome. Mother are angels, you have Angelman syndrome. Son, tall son, is Marfan's. Daughter, fair daughter, it is albinism. So remember, all of this is chromosome number 15. Okay, all of this is chromosome number 15. So albinism ho gaya, alkaptonuria, phenylketonuria. The other one we have already seen. Maple syrup urine disease. It is branch chain ketoacid dehydrogenase. There is a maple syrup or it is burnt sugar odor that we see with maple syrup urine disease. Okay, these are the ones which are very, very important, frequently asked. One question on this is very, very frequently asked. Okay. So, previously asked question, what is the enzyme deficient in Tay-Sachs? It is hexose aminidase A. What are we seeing in this one? Anyone? What is this image showing? Let's see who can identify this correctly. What are you seeing in this image? What are we seeing here in these images? No, very good. Nishta, absolutely right. This is galactosemia, which is basically showing oil drop cataract. Okay, this is oil drop cataract, which is seen in galactosemia, classical galactosemia, oil drop cataract. What is the enzyme deficient? It is Galiput. Remember it as Galiput, that is galactose 1-phosphate uridyl transferase. Remember, it is not 6-phosphate uridyl transferase. It is galactose 1-phosphate uridyl transferase, which is the enzyme defective. So whenever you have a history of cataract, think of galactosemia. Okay. Now, if you are asked oil drop sign in the nail, asked in the recent NEET PG exam, oil drop in the nail is psoriasis. Okay. Remember, it's psoriasis where you get the silvery scales, right? Silvery scales, oil drop sign in the nail. It is psoriasis. Now, what are the various cataracts? Remember, diabetes is snowflake or snowstorm cataract. Galactosemia, oil drop. Wilson is sunflower. Myotonic dystrophy, it's a Christmas tree cataract. Blunt trauma, it's a rosette-shaped cataract. There is Washius ring. Rubella also has cataract, very, very important. Downs में there is brush field spots, and steroids cause posterior subcapsular cataract. Okay, this is another frequently asked question. Steroids lead to posterior subcapsular cataract. Okay, posterior subcapsular cataract. Next one. This is again very important. What is the enzyme deficient in essential fructose urea? And what is the enzyme deficient in hereditary fructose intolerance? Now remember that essential fructose urea basically means it is benign. There are no symptoms, just that in the urine there is fructose which is going. So the problem is in the first step itself, fructose getting converted to fructose phosphate, that is affected. The enzyme deficient is fructokinase. Okay, the enzyme deficient is fructokinase. Intolerance is basically aldolase. Okay, aldolase is your fructose intolerance. Okay, it is fructose intolerance. So that is aldolase B is your hereditary fructose intolerance, where the liver is affected, kidney is affected, and there is failure to thrive. Remember this important points. Now, this is very, very frequently asked. If you have an alcoholic patient with neurological symptoms, right, what is the vitamin deficiency that you should think of? Remember, it is vitamin B1 deficiency. Very, very important. Basically, here we are talking about wernicase, which is vitamin B1 deficiency. Siddheshwar, you want mnemonics for what? Okay. So remember, it is wernicase, which is vitamin B1. So when you say wernicase, remember 1 again, W-E-N, it is 1. So that is vitamin B1 deficiency, wernicase. What is the triad? The triad is GOA. What is GOA? GOA is the global confusion. There is ophthalmoplegia and there is ataxia. Classical, that would be the history. So remember, in such patients, before giving glucose, we always need to give thiamine. Why? Because thiamine is required for glucose utilization. If you give glucose without thiamine, it will precipitate the symptoms. Okay. Yes. And what do we do for thiamine deficiency? What test? Transketolase. Another question in NEET PG 22. Transketolase is the test for thiamine deficiency. Okay. Next one. What LDH is increased in MI? Is it LDH1 or LDH2? So right, there is the flipping of LDH flipping is seen in MI. Remember, in heart, it is 1. Okay, it is LDH1 which increases, which is H4. So remember, heart is most important. It is 1 number organ. It is LDH1. Next, whenever you are given that it's the maternal uncle who has the disease, we just now in the initial part we discussed, the inheritance pattern is X-linked recessive. Okay, inheritance pattern is X-linked recessive. So remember that when you are given that, mother is transmitting the disease to all the kids, be it daughter, be it son. What inheritance it is? Mother to all kids. Remember, maternal wala is your mitochondrial disorder. Okay, mitochondrial disorder. When you have father is giving to all daughters, then it is X-linked dominant. Okay, then it is X-linked dominant. Okay? Alright. Next one. Mitochondrial superoxide dismutase. This is a recently asked question. What is the cofactor? Now remember, this mitochondrial superoxide dismutase, this has been linked to Parkinson's wala also. Basically, manganese toxicity we know can cause Parkinson's. Okay, so remember, it is manganese. Okay, it is manganese. Next one, very, very frequently asked, nitric oxide is synthesized from arginine. Okay, remember NiNi. When I write arginine, ulta padenge NiNi, do baar aata hai, it is nitric oxide. And what does nitric oxide do? Basically, it causes the dilatation, the relaxation of the smooth muscles. Remember, it causes vasodilatation and it causes relaxation of smooth muscles also. Okay. Now, important ones, the amino acid products. Remember, melanin is from tyrosine, but melatonin is from tryptophan. Serotonin is from tryptophan. So remember, TO is from tryptophan. Tryptophan is that is vitamin B3. So vitamin B3 is also derived from tryptophan. So whenever there is tryptophan may problem, remember lysine will also be deficient. So remember it can lead to pellagra. Okay, it can lead to pellagra. So what do we have is, what are the problems in tryptophan? Hartnup disease. Remember, Hartnup can present with pellagra. What other condition? Carcinoid can present with pellagra. Why? Because in carcinoid, there is increased synthesis of serotonin. So remember that all the tryptophan is going to serotonin. So lysine is not getting formed. And what is the classical clinical features in carcinoid? Very, very important. What is the classical keyword in carcinoid? Remember, there is diarrhea with flushing. Whenever you see diarrhea with flushing, start thinking of carcinoid. What is the tumor marker here? Serotonin wala product, 5-HIAA. Okay, 5-HIAA would be increased. What valve in the heart it affects classically? Remember, it causes tricuspid regurgitation. Okay, very, very important. There is tricuspid regurgitation. Okay, tricuspid regurgitation. Okay. So remember, tryptophan is serotonin, melatonin, lysine, NAD wala. Then you have arginine, which is nitric oxide, urea also. All your catechol amines, they come from tyrosine. Thyroxine also comes from tyrosine. Like thyroxine is rhyming with tyrosine. Okay, so remember it is tyrosine. Okay. Protein folding, a frequently asked question. What are the molecules required for protein folding? Remember, it is chaperones. What is the role of chaperones? It is protein folding. Ethanol, remember, is not given in fatty liver. Logically thinking, alcohol leads to fatty liver. So remember, it's not given. Which are the lipotrophic factors? This has been asked in your FMGE exam. Remember, climb. Climb is your lipotrophic factors. What is climb? What does climb stand for basically? Climb is choline, lecithin, inositol, methionine and betaine. These are lipotrophic factors. Okay? Ethanol is not given and these are the lipotrophic factors. Choline, lecithin, inositol, methionine and betaine. Okay, now this was asked in NEET PG 22 also. Complex 4 inhibitors of ETC. Remember all the IDEs, that is cyanide. Okay, carbon monoxide. Remember, it is carbon monoxide, not carbon dioxide. Okay, it is carbon monoxide, cyanide, hydrogen sulfide, azide. All these IDEs are complex 4 inhibitors. Okay, what is oligomycin? Oligomycin, remember, oligo is decreasing. Oligo means decreasing. It decreases the proton gradient basically in the complex 5. Okay, it is complex 5 inhibitor. Then you have atractyloside. Okay, remember atractyloside, ATRA, that is your ADP, ATP transporter. Okay, it affects the transporter. Okay, it affects the transporter. Okay. And which are the uncouplers? Remember this point, again frequently asked in your exam. Uncouplers, you have physiological, that is natural, and chemical. Thyroid hormones, basically when there is uncoupler which uncouples your ETC with the oxidation and the ATP formation, there's a lot of heat generation. So when there are a lot of excessive thyroid hormones, hyperthyroidism, we know there is increased temperature. So it's an uncoupler. Long chain fatty acids, unconjugated bilirubin, these are all uncouplers. Chemical, please remember 2,4-dinitrophenol, it is uncoupler. Okay, dinitrophenol is a chemical uncoupler. These are physiological uncouplers. Okay, right. Thermogenin, that's basically your heat generation wala. Okay, these are the enzyme deficiencies we have already seen. Phenylalanine hydroxylase, then you have albinism में tyrosinase, alkaptonuria में homogentisate oxidase. All your catecholamines basically come from tyrosine. Okay, they come from tyrosine. What is the amino acid which is abundant in collagen? Remember, it is not proline and lysine. The most abundant is, remember, collagen is GL, that is glycine. Every third position you would see glycine in collagen. Okay? Black urine on standing, we have already seen, it is alkaptonuria. The enzyme deficient is homogentisate oxidase. Okay? Which is the amino acid which contains disulfide bond? Very, very important. Remember, it is cysteine, which is the most important component of glutathione. Okay, it is the most important component of glutathione. Remember, thio is basically sulfide wala. So cysteine is very, very important for maintaining glutathione, which is important as antioxidant. Free radical scavenger antioxidant ka role hai. So remember, it's the cysteine which is responsible. Which are the antioxidant vitamins? Remember, ACE. ACE vitamins are antioxidant, ACE. Out of that, which is most potent? E is most potent. So ACE have antioxidant role and E is the most potent. Okay, E is the most potent. Wernicke's, asked so many times, remember it is vitamin B1, that is thiamine deficiency. Now this was asked in NEET PG 22, that is the test for vitamins. Remember, for B1 deficiency, we do transketolase. Riboflavin was asked. Remember, it is glutathione reductase. Riboflavin, remember RIRE, glutathione reductase. Pyridoxine is required for transamination. Folic acid, F for F, Figlu and histidine load test. And B12 deficiency, methyl malonate levels are increased. Okay, MMA levels are increased. And very favorite image with the examiners, whenever you see this, that is the Casal's necklace. This is Pellagra. Okay, where there is Casal's necklace, this is Pellagra. And what are the 4 Ds, 3 Ds of Pellagra? Remember, it is diarrhea, dermatitis, dementia. This is last year NEET PG question. And the 4th D is death. And they will give you the history that the patient is eating what as the staple food? Maize, right? Maize is frequently given. Maize is the staple food. So maize जो है वो niacin utilize नहीं करने देगा. So it is maize is the staple food. Diarrhea, dermatitis, dementia and death. Okay. Hartnup disease we have already discussed. Tryptophan wala pellagra like features आएंगे. Last one, Cushing's disease and Cushing-Beck disease. Remember, Cushing, AES is your SE. It is your selenium ka deficiency. Cushing-Beck is your selenium excess. Okay. Menkes is your copper ka deficiency. And in which mineral deficiency we see glucose intolerance? Chromium. Okay, remember it's chromium. So remember this point that Cushing's disease is selenium deficiency. Cushing-Beck is selenium toxicity. Cushing causes, it affects the heart. Cushing-Beck, B for bones, it affects the bones. Okay, and this is chromium which causes glucose intolerance. Okay, glucose intolerance. Another very, very important image where you see lesions perioral, perianal, in the hands and feet. This is acrodermatitis. Okay, this is acrodermatitis enteropathica, which is seen with zinc deficiency. Okay, remember acrodermatitis enteropathica. This is very, very important image. Periorificial, around the mouth, around the anus. Acro, matlab the limbs. Hand mein you will see the lesions. This is zinc deficiency. Okay, very, very important. This is zinc deficiency. Okay. In which glycogen storage disorder exercise is contraindicated? Muscles wala, M wala. Remember, it is McArdle's disease. Okay, muscle glycogen phosphorylase is defective. McArdle's. Okay. Urea cycle, where does it occur? Cytoplasm or mitochondria? Okay, cytoplasm or mitochondria. Remember, it is both cytoplasm and mitochondria. Both wala, the mnemonic is hug. We hug with both the arms. So, heme synthesis, urea cycle and gluconeogenesis, they occur in both. Fatty acid synthesis, an anabolic process, it occurs only in the cytoplasm. Fatty acid oxidation, most important, it occurs in mitochondria. It can occur in peroxisomes also. This is your beta oxidation. So remember, synthesis is in the cytoplasm. What is the rate limiting enzyme for synthesis? Acetyl-CoA carboxylase. Very, very important. Synthesis, SY is CY in the cytoplasm. It is acetyl-CoA carboxylase, which is the rate limiting enzyme. The building block is the acetyl-CoA, to which we add carbon, and the first fatty acid which is synthesized, it is palmitic acid. Okay, it is palmitic acid. All right. What are the steps in PCR? Another important question. So the step is when you have a DNA molecule, आपको PCR करना है, polymerase chain reaction. First is denaturation, then you put the primer, annealing the primer, and then there is the extension. So arrange in the steps. It is denaturation, annealing, and extension. DNA polymerase would be required. Thermostable वाला जो use करते हैं, Taq polymerase use करते हैं. ठीक है? And your blotting techniques, another important question for blotting techniques. Remember, snowdrop is the mnemonic. Okay, it is snow and it is drop. That is S for D. Southern blotting is for DNA. Northern blotting is for RNA. This is 0, 0. And western blotting is for proteins. Okay, western blotting is for proteins. If I ask you about southwestern blotting, south is DNA, west is proteins. So basically it is DNA and proteins. Northwestern, north is RNA, west is proteins. It is RNA and proteins ka interaction. Okay, RNA and proteins ka interaction. Okay. So yes, I think this was all about the quick review of the important topics in biochemistry, the recently asked. Please watch all the NF100 episodes. Quite a lot of biochemistry has been covered there, including your lipoproteins and dyslipidemias, very, very important. The rate limiting enzymes of all the cycles are important. Please read that as well. Vitamins has been discussed in detail. Watch that as well. Okay. So that was for today's session. When are we meeting next for your FMG last minute revision? Tomorrow we will be having a radiology, all the important images of radiology that you should be revising. So watch that. Majority of your radiology questions would be solved. So radiology LMR tomorrow at 5:30 p.m. That is the plan. Same YouTube live. I'll be sharing the link on the Telegram group. Okay. Thank you so much, everyone. I hope you found this useful. So radiology is what is the plan for tomorrow. Okay. I am pretty sure that you'll get a lot of questions from this session that we have discussed. So make sure you revise this. Okay. So thank you so much, everyone. Let's get back to studies. Just 2-3 days remaining for the exam. And I'll see you again tomorrow at 5:30 p.m. Till then, goodbye. Take care and keep studying, keep revising and keep winning. We'll meet on this YouTube channel again tomorrow. So make sure you are subscribed and you are, you get a notification for the class